Fibromyalgia is a disorder characterized by widespread pain and often coexists with other painful conditions. It is one of the most common chronic diseases, affecting as many as 10 million people in the United States. Dr. Mohamed Elsharkawy at Pomona Valley Hospital Medical Center talks about fibromyalgia, who's at risk, and the symptoms.
According to the Fibromyalgia National Association, about 75 to 90% of patients with fibromyalgia are women. So women have more risk. Family history. So if you have a sister or mom or cousin or someone in the family has fibromyalgia, there's a tendency that you might have fibromyalgia too. If you have recurrent stress, if you are constantly fatigued and tired, these are the major risks. It starts intermittently and then become constant. The American College of Rheumatology put some criteria to diagnose fibromyalgia, and one of them, like I said, it has to be chronic, and sometimes start one focused area in your body that hurts all the time and you feel tired, or just all the body generalized.
Both doctors and patients have a part to play in fibromyalgia treatment.
Once we make that diagnosis, the patient has to learn a lot about fibromyalgia. It's one of those, exactly like when you have diabetes. If you have diabetes, you have to learn about insulin, how to eat. Same for fibromyalgia. You have to learn how to live differently so you can help yourself get better. So that's part of the treatment. The other part of the treatment, which all of us go to the doctor for, is the medicine. We want some medicine. So the medications typically are the medication that we use for antidepressants. And the reason these medications help in fibromyalgia, it affects how the neurons in the nerves works in our body. So it increases some chemicals and decrease other chemicals, and they found it actually helped the patient with fibromyalgia. One of the things that helps significantly once you understand your diagnosis, take your medicine correctly. Typically it takes a few months before you say, yes, I feel much better. And as you evolve and you start to change your lifestyle and you become really committed to that medication that your doctor gave to you, you see significant improvement, yes.
Dr. Elsharkawy gives us a patient's story.
This patient, she is in her mid-30s, and I have known her recently, but seems that the previous doctor who was seeing her made the diagnosis of fibromyalgia. She's very knowledgeable about the disease. She has changed a lot in her life. She's a swimmer now, and she does this and that. But she takes medicine too. She takes medication that have been helping her significantly. This patient gets pregnant, and now she's like, I don't want to do anything with the medicine affecting my baby that much. And although these medications are safe, she doesn't want to take any risk. So we stopped the medicine. And because she did her job and she learned about the disease, changed a lot in her life, her symptoms slightly back, but not as bad as she used to have it. So I think just because she understood what's the disease and she worked on, modifying her life and making some changes, she has already succeeded. And I don't think she might never need the medicine again. The best advice I can give to a patient is start to work on your lifestyle. So if you learn about your problem, start to change your life slightly to get better.